Hi everyone. In today's clip, I will talk a little bit about cervical dystonia. This is just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Cervical dystonia is a brain-driven movement disorder, not just a muscle problem. The brain motor circuits sort of misfire, sending irregular signals to the neck muscles, and in turn, the muscles contract involuntarily, which causes the head to twist, tilt, or jerk. Think of it like a faulty rhythm conductor in the nervous system, not a damaged neck, so to speak. The modern medical understanding and treatment for first line is considered, which is considered most effective, is Botox or botulism toxin injections into overactive neck muscles, which works by temporarily blocking the nerve signals to muscles, and the effects last about 3 months. Then the repeat injections are going to be needed, and they do not have a fixed universal dosage for this because it all depends on muscle patterns, severity, and body response. So this is always individualized by a neurologist. They also prescribe oral medications, which are supportive, not curative. These are used when injections are insufficient or unavailable. There's also, of course, physical therapy and rehabilitation, which is a major pillar, often actually underestimated, which is done through stretching of overactive muscles, strengthening of opposing muscles, and posture retraining or sensory trick. Like, for example, touching the chin or cheek, or touching your face in general, or turning your head slightly, or holding something. And this helps the body move more normally for a short period of time. Advanced treatments right now include deep brain stimulation, or DBS, and it is used in severe resistant cases. In this, electrodes or thin wires are placed in specific areas of the brain, and a pulse generator, like a pacemaker type of thing, is implanted under the skin in the chest with a connecting wire, sort of linking them to each other. The device sends small electrical signals to the targeted brain regions to regulate abnormal signals and improve movement or symptoms. There's, of course, also suggested pain management through heat therapy, trigger point release, and massage therapy. Traditional approaches include warm compresses for muscle relaxation, herbal anti-inflammatory poultices, massages with oils like mustard, sesame, and eucalyptus infused oils, gentle traction or manual therapy, breathing and relaxation rituals to reduce stress-triggered spasms. And in classical medicine, this and similar conditions, sort of resembling cervical dystonia, fall under neuromuscular imbalance, often linked to excess cold and dry humors, which is affecting the nerves, as well as nervous tension and imbalance of brain-derived control. As I have mentioned in my previous clips, we have 4 humors in the body. We have blood, which is warm and moist, yellow bile, which is warm and dry, black bile, which is cold and dry, and phlegm, which is cold and moist. These are also called temperaments. So we historically approach this through warming therapies or hot compresses to relax the stiff muscles, warm oil rubs, often sesame oil, because oils are considered nervine relaxants. Herbal sedatives like lavender and chamomile, and anti-spasmodic plant extracts. So disturbance of nerve temperament is basically looked at as excess coldness plus dryness in nervous tissue, and sometimes wind-like obstruction in nerve pathways, which is the spasm concept. The goal is to warm, soften, relax, and restore the flow. So external therapies that we most emphasize are daily warm oil applications, which are used as muscle plus nerve relaxant, such as sesame seed oil for deeper warming and muscle relaxation infused with chamomile or lavender. So you will warm the oil basically gently, not hot, and massage the neck and upper shoulders for about 10 to 20 minutes and focus on the big neck muscle sort of that helps you turn or tilt your head, and the large muscle across the upper back and the shoulders, and the small area at the base of your skull on top of your neck, and the frequency should be about 1 to 2 times a day. There's also heat therapy or steam compresses or warm cloth packs, which are applied 15 to 30 minutes a day, and the goal is to soften the contracted fibers. Also, lifestyle prescriptions are extremely important and include avoiding cold exposure to neck, avoiding emotional agitation, sleep regulation, because early sleep causes nerve restoration at time. So, and a gentle neck movement, not forceful stretching. Castor oil packs are also tried and true for this condition and known to relax the muscles, reduce pain, and calm the nervous system. The basic method is to ensure the neck is clean, then apply the castor oil on a cotton cloth and place it over, and this is warm castor oil a little bit, place it over the neck and upper shoulders and cover it with another layer and apply heat like a hot water bottle probably, and relax for about 20 to 40 minutes a day, 3 to 5 times a week, or even daily if you would like. In orthomolecular medicine, we suggest correcting biochemical imbalances via nutrients, which include magnesium for muscle relaxation role, vitamin B complex, which is nerve support, vitamin D3 and K2 in MK7 format for optimization, omega-3 fatty acids for anti-inflammatory signaling, and antioxidants such as vitamin C for general neural support. So magnesium is a key player due to the fact that it has neuromuscular calming effects and it reduces excitability. Typical supplemental range, I should say, is 400 milligrams a day elemental magnesium in the form of magnesium glycinate, which is gentler, or magnesium citrate, which has more laxative effect and easier to absorb. Then we have vitamin B complex, which is intended for nerve signaling support, and the key focus is being on vitamin B1 or thiamine, B6 or pyridoxine, and B12 or methylcobalamin. And the typical supplement range is usually 100 milligrams a day of the B complex, and B12 often around 1,000 to 3,000 micrograms a day. Then we have omega-3 fatty acids, which are anti-inflammatory and are for neural modulation, and the dosage is around 1,000 to 3,000 milligrams a day combined EPA and DHA. Then there is D3 and K2, as I mentioned, MK7 formula for neuromuscular regulation support, which will be 2,000 to 3,000 international units a day. And make sure that for every 1,000 international unit of vitamin D3, there is at least 120 milligrams of K2, which is accompanied. Then there's taurine, which is calming for neurotransmitter modulation, around 500 to 2,000 milligrams a day, and CoQ10 for mitochondrial support, about 200 milligrams a day. There was a question around the use of DMSO for this condition, and what I can say is that DMSO, or dimethyl sulfoxide, is a sulfur-containing solvent originally used in industrial chemistry. In medicine, it has been studied for anti-inflammatory effects, pain reduction, tissue penetration enhancement, because it carries substances through the skin, and nerve-related pain conditions. I have not particularly seen specifically this being used for cervical dystonia treatment, but I did see literatures done by Russian clinical studies which reported 30% topical DMSO compress applied for about 1 to 1.5 hours daily over 2 weeks, improved muscle dystonia and improved neuropathy symptoms, and it reduced pain and vascular symptoms in occupational vibration injuries. This was not cervical dystonia though. DMSA compress can be done by ensuring the area of the application is thoroughly cleaned with a soap that is free from perfumes and chemicals. The DMSO is going to have to be mixed with distilled water, not tap water or any other water, with distilled water to 30% solution, never full strength, then soaking a clean, plain cotton cloth with no dyes or other material on it in the diluted DMSO solution and placing it on the target area for about 15 to 45 minutes and applying heat over it. Then you remove the compress and rinse the area with water and let the skin air dry. What is known is that DMSO can reduce inflammation signaling, alter nerve membrane excitability, change water structure around tissue, and increase drug or matter penetration through skin. Hence, it can cause reduction in neck tightness, reduce muscle pulling sensation, and it is analgesic, which means it has pain dulling effect. So if you decide to use DMSO, though, please check the clip that I have posted a while back in how to handle and apply this, as you definitely need to apply caution because there is potential contamination transfer into bloodstream if applied with impure substances. Also, if you are on any medication or you're having Botox injections, DMSO stops at that point being just a compress and it will start becoming pharmacology wildcard. So please, before taking this matter into your own hands, definitely consult your healthcare provider. On the metaphysical side or interpretations of cervical dystonia, we look into control versus surrender symbolism because neck equals axis of orientation. In many metaphysical traditions, the neck is seen as the bridge between the mind, which is head, and the world, which is the body. The axis of orientation, choice, and direction. So cervical dystonia is sometimes interpreted symbolically as tension between where I want to go versus where I feel I am forced to go. So, so a conflict between conscious direction and deeper instinctual sort of movement. In this lens, the involuntary turning is read as the body refusing a single fixed orientation, not literally, but symbolically. This issue is also looked at as trauma memory stored in body patterns, or what is called a held experience, unresolved emotional shock, or nervous system freeze patterns. The neck specifically is often associated with suppressed expression, hypervigilance, always turning to check, and difficulty resting in one perspective. Neck twisting can symbolize inability to hold a single viewpoint or persistent inner conflict between directions in life. Hope this has been helpful. My clips are available on TikTok and YouTube. Like, share, and follow for more. Be the light.